Hello everyone. Did you know that the prevalence of idiopathic normal pressure hydrocephalus may increase to the double between the age 70 and 77, and that the incidence of INPH may be as high as in Alzheimer's disease? I'm Mats Tullberg from Gothenburg, Sweden, and I'm going to talk about the Hydrocephalus Society paper of the month. Idiopathic normal pressure hydrocephalus, incidence, prevalence, and progression in a large population-based cohort of older adults, which was recently published in Neurology Open Access. So there are many studies indicating that INPH is underdiagnosed and undertreated, but we need more data showing the true prevalence and also incidence of this disorder. And prevalence and incidence can only be studied in population-based samples with individuals from the general population, not individuals or patients who have seek medical care and who has been treated, because such studies usually underestimate the true prevalence and incidence. And this is what we wanted to do in this paper, where we aimed at looking at incidence, prevalence, and also progression of INPH over 6 years. So this is a longitudinal population-based study conducted within the Gothenburg age 70 birth cohort study. So we could select systematically recruited or selected 70-year-olds who underwent baseline assessments at age 70, and they were then followed up after in median or mean 5.8 years, so a second assessment. And this assessment included a thorough evaluation of gait, balance, cognition, and urinary symptoms. It also included an MRI of the brain at both time points. And so using a combination of the clinical symptoms of INPH defined as they are in the international guidelines from 2005, where you need gait and balance disturbance plus cognitive and or urinary disturbance. On the one hand, on the other hand, MRI images were assessed, visually quantified and assessed for changes typical of INPH, also in accordance with the international guidelines. And using these two parts, we could diagnose patients as possible INPH according to the international guidelines. We also looked at patients with typical imaging features, but without the full clinical picture, either no symptoms at all or symptoms that were less widely engaging the different parts as necessary in the guidelines. And we call this group INPH with radiological features only. I will come back to that. And interestingly, we found a prevalence at age 70 of 1.5%. So that was the prevalence at age 70. And this is reported in an earlier publication by us. If you want to read more, you can look at that publication. Came out in 2024. So starting at 1.5% at age 70, we found an prevalence of 2.9% at the age 77, so almost twice the figure as at age 70. We also found that asymptomatic INPH with radiological features only increased from 1.5 at age 70 to 2.3 at age 77. Further, we could calculate the incidence, the number of individuals developing INPH, possible INPH over the years. And we found an incidence of 5.8 per 1,000 person years. And we also found we could describe the development of asymptomatic INPH with radiological features only. We also looked at predictors who could tell us or hint at who would develop INPH from baseline. We looked at vascular factors, we looked at radiological features. And what we found was that a higher baseline body mass index was associated with an increased INPH risk. Further, the ventricular size, described as the brain-ventricular ratio at the anterior commissure, was associated, as was the corpus callosal angle. Those were the strongest predictors of the development of disease. So in conclusion, the incidence was 5.8 per 1,000 person years, and the prevalence doubling over the study period, which is really 6 years, which exceeds previous estimates. And we also found that quite many developed disease. So during follow-up, 43% of patients with asymptomatic INPH with radiological features only, and 67% of those with radiologic INPH with isolated symptoms, they progressed to INPH. So we conclude here that this data indicates quite high figures of prevalence at age 70 and 76, that the incidence may be as high as in Alzheimer's disease, and that during a follow-up of 6 to 7 years, there is a high risk of developing INPH if you have radiological features or only symptoms that are still do not qualify for the full diagnosis. So, having said this, I hope you will enjoy and get interested in reading the paper, and hope you will enjoy it. Of course, more studies and research needs to be done also in other countries. I would say that I think this study underlines the importance of INPH and the fact that we still do not diagnose and treat all patients. The prevalence is higher than described when we look at how many patients we treat. So I want to thank you very much for listening, and as I said, paper of the month, Hydrocephalus Society, about incidence and prevalence and progression of INPH. Thank you.